Alright guys, so I'm back to show you guys what is in the baby version of my hospital bag, or the diaper bag, for Keith III, aka Trey. I do also want to make a note that not only did we have the mommy and the daddy bag, which you saw in the previous video, not only do we have Keith's diaper bag, but we also have a bag packed for Kimora. This is Kimora's emergency bag that is going to always be packed. I'm not going to show it to you guys, but I'll briefly tell you what I put in there. And it's so that if I go into labor at a random time, or, you know, just for whomever comes to get Kimora when I go into labor to watch her, whether they just come to our house to watch her in her own setting, or whether they're taking her back to their home, or whether we're dropping her off somewhere, we have this emergency bag pack that can go with her that will last her up to 2 days time. So she has, I believe, 4 outfits, top and bottom, packed in there. She has a whole pack of diapers, a brand new pack of wipes in there. She has her sippy cups in there. She has her Kid Tough iPod, which I'll be doing a review on that soon. That's a fun little toy. She has her iPod in there to keep her occupied, and there's going to be her toothbrush, of course, and pajamas are in there, and also cash is in there. So if whomever is watching her needs to take her to McDonald's or something like that to get some food because they don't have food in their home or something like that, or they don't feel comfortable going in our cabinets, then they can do that. So that is Kimora's emergency bag. Alright guys, so enough rambling. This is the baby's diaper bag, or hospital bag. It also does not have much in here. Because, like I keep saying in these videos, I think we overpack, and the hospital provides so much for us at the hospitals and for the babies. They really do. And like I said, again, we live so darn close to our hospital. So, all I have in here is a blankie, a nice soft blankie for the baby. Especially for like when people hold the newborn baby, you know, they can put this over them so that baby isn't getting their yucky germs on their clothes or their skin. Also in here I have just a little safety kit. It's not like a brand new packaged one, it's just one that I put stuff in, which includes some Desitin, a snot sucker, which I really like this one, but the hospital ones normally work pretty good too, so we'll compare. And it also has some fingernail clippers in here. So I have that. I also have a baby thermometer somewhere. I just have to find it, and I'm going to stick it back in here. And if I can't find it, I'll probably buy a new one to put in here. So then I have a new pack of NUK pacifiers. Kimora hated the hospital pacifier. So I'm not sure if Keith will like it, but if he doesn't, then I'm going to see if he likes these. And if he doesn't like these, well then he'll just have to wait until he gets home and he can try some of the other ones that we have here. But I thought these ones were really cute. They're just blue with ABCs on them, so I brought these. Then I have some good old hand sanitizer for all those visitors that come and want to touch on my baby, and for me and Keith. We don't get passes either. Hand sanitizer. Some baby lotion. This is actually one that I've been using. I didn't want to bust open the new one yet because this one still has some in there, but I use this lotion sometimes too. But just baby lotion. I doubt that I will need to put it on baby that often or at all when I'm in the hospital, but just in case. A pack of Pampers Wipies. 5 newborn diapers, which I don't know about any other second-time moms out there, but I'm so in awe about how small these freaking diapers are. Now, granted, I know I just had a child not even 2 years ago, but her diapers are a lot bigger than this now. And I just can't remember her being this small to fit these little diapers. Like, it baffles me. They're so cute. I can only imagine what preemie diapers look like if they sell this. I don't know. Okay. So then I have in the front part here just this little kind of like wet bag thingy, which has 2 receiving blankets in here and this little teething toy, which little Keith isn't going to have any teeth, so I really don't know why that's in there, but it is. This little wallet has insurance card and information in here and doctor's information for Kimura, which will also be the baby's doctor, so that's why it's important to have that, and a Band-Aid. Somebody might get a boo-boo. Alright guys, now the fun stuff, the outfits and all that good stuff. You see, there's not much in here for a little Keithy because he doesn't need that much. Oh, one other thing that I do have over here on the side is simply, I can get it out, one Tommee Tippee bottle. Now I know you guys are probably like, oh, but she's breastfeeding, right? I am going to be breastfeeding, but you never know what the freak might happen at the darn hospital. What if for some reason I can't breastfeed for like some mysterious reason, or something happens to me and I'm away from the baby and Keith has to take over? I'm being silly. But just in case anything like that did happen, I want the baby to use the bottles that I want, because I don't want there to be like any crazy, like all these different nipples going in the baby's mouth, which is also why I might hold off from the pacifier depending on how low-key he is. But if for some reason he has to use a bottle, I want it to be the Tommee Tippee ones, the ones I plan to use. So I'm just going to bring one just in case, but I do plan to have him on the boob the whole hospital stay. Okay? Alright, now when it comes to outfits, I have a little stack. It's not really that much. One is just a work onesie that has the name of my job on there with the little baseball hat so that I can take pictures and send to my boss and my coworkers when he's born in one of our own onesies. I thought that would be really cute. Then I have this little sleeper for him, which I believe is so cute. I love blues and yellows together. And then we have 2 choices of a going home outfit. So as you can see, besides his going home outfit, this is all I brought for him, because I know that he's probably just going to be swaddled up in a blanket the majority of the time, and the nurses are going to keep coming in and poking him and all that stuff. And if he has on too many outfits that are like this, that have to be unbuttoned and all that good stuff, the nurses are just going to get annoyed, which is going to annoy me, which is going to annoy everybody. So to avoid all of that, I'm not bringing that much. Now I may go and pack some of those gowns that are just like a gown and they have the bottom open. I forgot that I have some of those, and I might pack maybe like 1 or 2 in my diaper bag, which I believe is actually a good idea. I love those things, and I might go do that right after this video. But anyway, going home outfits. So the first choice was me and Keith's first pick that we went out and bought at Kohl's when we found out he was a boy, which is this little froggy hat. That was so cute. These little froggy pants. How cute. And this little froggy onesie. So adorable. And this little cuddle bug bib. So that's one outfit that he will be comfortable in, and that's newborn. Now, just in case he's a little bigger, maybe he comes out a little big boy, then we have these little shorts for him, which are newborn, but this onesie dinosaur is 0 to 3 months. So just in case maybe he comes out like a big old chunky boy, which I doubt he will, and needs some additional clothing, then there's that outfit. And also, just in case we want to switch it up a little bit or he spits up on it, this says God's Little Masterpiece, and it matches those same shorts. So that's in case like he spits up on his shirt or something like that. Or if maybe after we leave the hospital we stop somewhere and he messes up his clothes, I can always change him into that. Believe it or not, when we had Kimura, we did not go straight home after leaving the hospital. We went to my grandparents' house, to his parents' house, to my parents' house, and I was pooped by the time we actually got home. I'm not going to do that again this time. I don't plan on it. So, that is what is in my baby's bag. I don't think that I'm missing anything, but you guys can definitely let me know if you think that I'm missing anything that should be in my baby's bag. Yeah, I mean, that's my baby's hospital bag, you guys. Like I said, if you didn't see my hospital bag for the adults, just check out the other video. And I'm trying not to overpack, trying to keep it simple, keep it moving. These are going in the car, minus the last minute stuff. And the car seat is already in the car as well. So let me know if you guys want me to maybe eventually do a video on infant car seats and toddler car seats. Maybe I'll do that. Otherwise, I guess I'll show you guys my 38-week belly, since I neglected to do that in my blog. So, it's my belly. So I definitely think I've dropped. Tell me what you guys think, and I will see you guys maybe for week 39. Bye.